Hello, everybody. Thank you for inviting me to such a great event and to discuss about this important topic of climate change and health. I'll be very short. I would like just to present an overview of what's happening in Romania in terms of strategies, public policies, and empirical research. And I would like to start by showing trends in the climate profile and the demographic profile of the country, indicating vulnerabilities and the need to create space for more determined measures, both from the government and non-governmental institutions. In terms of the climate profile, Romania has a transitional temperate continental climate with oceanic influences from the west, and we had an average annual temperature variable with the warmest year in 2015 and the coldest one in 1940. According to the National Meteorological Administration, we had in the past 12 years, 9 from to 10 the warmest years in the period 2000-2018. And 12 years recorded positive thermal anomalies higher than 1 degree Celsius in the 7 years consecutive from 2012 to 2018. The same agency modeled and created some projections showing significant changes in climate over the coming decades, near medium future up to 2015, a mean annual increase of temperature up to 3 degrees Celsius in summer, a mean reduction in summer precipitation from 8% to 9%, and changes in extreme phenomena such as increases in frequency and intensity of heat waves, increases in intensity of precipitation, and further reduction of mean rainfall in summer months, more pronounced for higher emission scenarios and stronger as we approach the end of the 21st century. The worst scenario cases from 2060 to 2090 will be characterized by mean summer temperatures about 6 degrees Celsius and the mean rainfall reduction in summer months up to 30%. In terms of demography, we also have vulnerabilities, and we are facing an aging demographic structure. As for the health status of the Romanian population, according to the World Health Organization regional office in Europe, the leading cause of death is cardiovascular diseases, while mortality rate for cancers has increased in recent years for lung, colorectal, breast cancers. Some of the determinants are behavioral, but many of the determinants are environmental. So the medical world is becoming more aware that the environment is very important in the causal chain of chronic and acute diseases. In terms of trends of greenhouse gas emissions in Romania, according to the 4th biennial report from 2019, we had an estimated 114 GG CO2 equivalent. And as a member state of the EU, Romania has committed to continuing to the achievement of the joint EU-wide emission reduction target of 20% below 1990. There is a trend of measuring the level of greenhouse gas emissions in Romania, and we now have a national system for the estimation of anthropogenic greenhouse gas emission levels, and we archive the national greenhouse gas inventory. In terms of monitoring the health status of the population, the National Institute of Public Health created a national center for risk monitoring in the community environment. And this entity has several important objectives in terms of climate change, because it identifies health monitoring priorities in relationship to the environment. It participates to the elaboration of strategies regarding prevention of diseases, surveillance and control of diseases associated with environmental determinants, prepares the annual report on the health status of the population in relation with environmental factors, and organizes a series of national conferences, some of them presented to a specialized audience, and some of them with press releases to a larger audience. In terms of databases, it's important to talk about the National Electronic Environmental Register, the recent MED. It was established in 2019, and it is an online software system in the form of a website accessed through a web portal connected to a database structured in 4 main categories, whose access is performed only by users registered in the system. And the main objectives of this database is to identify vulnerable groups of in certain extreme weather situations, monitoring and supervising the health status of the population, establishing measures regarding prevention and diminution of negative effects of the exposed population, and evaluating and ranking negative effect of meteorological situations on the exposed population. Also creates releases to inform the population on the risks associated with climate change. The input is provided by territorial public health directorates, and this means that all counties are involved in this input, and the register provides the data necessary for the promotion of an evidence-based medicine. At least the creators hope that it will be used to create better public policies based on current data. When it comes to the national legislation, I shall start by saying that there is no national climate law in Romania as yet, but there is an air quality law established in 2011. And in terms of relationships with the EU, we can see that the major policies are in fact reflecting EU policies at the national level. And also there is a very direct collaboration with the World Health Organization, and there is an office in Romania establishing priority activities, and they work through this biennial collaborative agreement, and this is important because it also supports some other national health policy and plans, such as the National Health Strategy 2014-2020, Romania's Sustainable Development Strategy 2030, the National Strategy on Climate Change, and the action plan for the implementation of the National Strategy on Climate Changes, and also some research. When it comes to empirical research, what I could see is that there are many institutions involved, such as the Romanian Academy and some institutes from the Romanian Academy, the National Meteorological Administration, and several universities. I could identify several groups. For instance, one group of researchers led by Dr. Robert Sepp, which is focusing on the relationship between climate change and health, and the study of the impact of particulate matter on different chronic pathologies. And also there is a group of researchers led by Professor Proroku, and they are creating also a database on air pollutants and the impact on health. I would like to mention the recent proposal for the integrated national plan in the field of energy and climate change. It's important to us because it's going to include healthcare facilities such as hospitals into the plan for renovation and retrofitting, and the increase of energy level. And they would like to create new and better fitted hospitals in the future. When it comes to the human resources, there is an attempt to create awareness that there is a need for the younger generation to be formed into the subject of climate change, and more specific in the universities of medicine, on subjects related to the impact of climate change on health. But I think these objectives are far from being realistic right now. So we hope for better coordination in the future. Thank you very much.